Hi viewers, my name is Dr. Salman Shafiq. I'm a consultant psychiatrist based in Lancashire, England. I'm making this video to introduce my paper that is published in Global Psychiatry Archives. The title of the paper is Views of British Asian Muslim Leaders on Mental Health, a focus group study. It is perfectly natural for anybody to seek advice from people around them if they have any difficulties or problems. When it comes to change in a presentation of a person who starts behaving differently, a bit unusually, and starts displaying patterns and presentations that cannot be explained, again, it would be perfectly natural for anybody to seek advice from family and friends and elders in the community. In South Asian communities, the religious leaders play a very important role, and people reach out to them to seek advice and to have their opinion if they are struggling with anything. When people receive advice from elders of the community, including religious leaders, then they try to follow that advice, and that determines the pathway that they follow to find a cure or solution that they are seeking for. Health issues are no exception either, and when people become unwell, they seek advice from others, including religious leaders. The aim of this paper is twofold. It is one of the aims is to find that how do South Asian Muslim religious leaders living in Lancashire understand mental health, especially the condition called psychosis. And secondly, the findings will inform the cultural adaptation of a toolkit that is used to support relatives of the people who suffers from psychosis or bipolar affective disorder. This toolkit is called REACT, REACT, which means Relative Education and Coping Toolkit. In order to find how do members of community and religious leaders understand mental health and psychosis in particular, we invited them and we carried out a focus group study which comprised of members of the community, religious leaders, and a research team. This paper is the outcome of that discussion, and it is all descriptive, so I'll be describing things for you. And we carried out a thematic analysis, which means that we transcribed the entire discussion from a WAV file, a voice file, into the typewritten Word file. And then we went through all the text and we tried to find that what are the themes that emerge as an outcome of analysis, as an overall what the participants are talking about. So with regards result, we found five meta themes, five major themes that the participants talked about. They are all in the paper, and I won't go through the details of them, but I'll read the themes for you. The first theme is the spirituality and its relationship with health is a complex and complicated area that is beyond ordinary comprehension. The second theme is that supernatural reasons can cause illness, faith, and religion are the answer. The third meta theme is that the NHS is deficient and needs to learn the cultural needs and demands of South Asian community. The fourth theme is that by engaging in debate, religion can face some threats. And the five meta theme is that of miscellaneous. As I said before, I'm not going to go through the details of these themes, and I would suggest you to have a look at the result sections of the paper where you can find all the details. In summary, in nutshell, the religious leaders took interest in understanding that what could be causing a very unusual presentation in a person, and they took interest in understanding that could there be mental health problems that can cause it, and if these mental health problems are different from, for example, a major condition, depression, then what that can be, and if those conditions can respond to psychotherapy or not. They took keen interest into understanding that. However, at the same time, they also felt that the similar kind of presentations can be caused by spiritual reasons. and supernatural reasons can play a role. They identified certain reasons that can cause spiritual problems, for example, distance from religiosity or weakness in faith, etc. And they identified that there are certain ways in which the supernatural reasons can cause illnesses, for example, infestation of spirits called jinns, or amulets or charms called taviz, or evil eye or nazar can be, for example, some of the reasons that can cause that. The participants felt that in order to best support the South Asian clients, it can be done that the spiritual leaders or faith healers and the medical doctors can work together, and the community can work with the National Health Services for them to understand what this cultural paradigm model of illness is, and the NHS can also help local community understand that what the medical model of illness is. Subsequently, in the discussion part, I have elaborated further on the results, and I have brought examples together from various communities of the world that have similar and different kind of explanatory model of illness. And finally, I have made a note about the epistemology, that is the theory of knowledge, i.e., the knowledge that we gain from the world. And I have elaborated that in addition to the personal knowledge acquisition, there can be social factors that contribute towards imparting knowledge towards an individual and a society. Uh, and that social epistemology determines the world views and explanatory models of illnesses that vary from person to person and community to community. For details, please see the paper. Thank you very much for listening to me. Bye for now.